Miss Jones. I'm Dr. Perkins. So what brings you in today?
I'm coughing.
You're coughing? Okay, well let's sit up here so I can get a listen to your heart and lungs.
Dr. Perkins, call on line 2. Dr. Perkins, call on
Now
line
that was my dream in that skit. Now on to my presentation. Exploring Medical Professions interview presentation by me, of course, Kaden Perkins. I first wanted to start out talking about what had me involved in the healthcare field and what persuaded me to go this direction. And I wanted to choose what that was with my jobs. I have 3 different jobs that included the healthcare field that helped me guide to where I am now. My first job ever, I was 16 and I started working at Princeton Healthcare Center. I started working there as a sitter, which I would sit with the patients, document, and then report back to the nurses or whoever may need that information. And then as time went on, I also became a CNA there. I was a temporary CNA due to the COVID-19 pandemic. That was very, very hard for me, and it was very difficult, but I did enjoy being with the patients and the residents there. This leads me to my second job, which I started about a year and a half ago, and I'm not there anymore. But I worked at the Mercer County Health Department as a contact tracer. And I did this for COVID-19. I would call the patients who had COVID, talk about their symptoms, and report as well. I also did this while working at the nursing home simultaneously. I worked at the nursing home on the weekends and worked at the health department on the weekdays. I then quit that job to get a new job at New River Dermatology back in May. This is where I am still at now. I absolutely love this job. I'm a receptionist here, and with a receptionist comes many qualities. I talk to these patients, schedule appointments, do refill requests, really anything with the patients, and I absolutely love that. I love being involved with the patients, even if I am on the lower scope of practice right now. Also, I want to mention is I get to talk to the doctor, the PAs, and also the nurse practitioner we have there, which they help me out a lot. This brings me to what I want to do in my future, and that is to be a family physician. And this is going to be through West Virginia School of Osteopathic Medicine. Next to who I interviewed Jamie Carosi, who is a physician assistant, Christina or Nina Rice, who is a family nurse practitioner, and Brianna Jones, who is an LPN. For the questions, I summed up a lot in the PowerPoint rather than go through every single question. But these are the questions that I had asked. Tell me about yourself. What prompted you to decide to go into healthcare? What did you choose your education route to be? What does your job as a PA, NP, or LPN consist of? What are some pros and cons of your position? And what, if anything, would you change? What advice would you give someone going into the medical field? The first lady I would like to talk about is Jamie Carosi. She is a physician assistant, and she is actually my PA at a family practice office. She has been there for about 15 years. And the pros and cons that she had gave, in quotes, is the best thing about my job is to help the patients. My small children love coming to the office and are rarely scared to come in, which is a goal of mine. I want my office to be a welcoming and happy place. A con is you are definitely never off work. Patients have questions all the time and definitely like direct contact with a provider. Her advice is, my advice to all patients or students choosing their path, find the thing that makes you happy. We have to work a long time to find that job that you don't consider a job. No matter how hard or busy my job gets, I still enjoy it and my patient. Advise, live at home, take out very little student loans, and enjoy school. You will be working soon enough. And she was the closest person that I could find or be able to talk to that is closer to what I want to do. My second lady I would like to talk about is Christina or Nina Rice, and she is a family nurse practitioner. I actually work with Nina at New River Dermatology, and she has been there for almost 2 years. A pro and con that she had mentioned is, A pro is that I can diagnose things and treat them, whereas in the past I would know the diagnosis or treatment, but lack the degree and education to make those judgments legally. A con would be the responsibility. You have to make sure everything you are doing is in the best interest of the patient and do no harm. Her best advice is to always persevere. It is tough. There will always be something making your path difficult, which would be pandemic, stress, abundance of literature, and burnout. Just remember what you want. And then the third lady I'd like to talk about, I'm very close with, and she is my sister, and I'm so very proud of her. But she is a licensed practical nurse, and she is also going to school now to be an RN. She's a mental health nurse, and she's been there for approximately 5 years. The pros and cons she would give is the pros would be that I can help those transitioning from being mentally ill and incarcerated to society. The cons would be 90% of the patients who are in the program are unable to complete the program due to relapse and reincarceration. The best advice for the field of nursing would be to start as a nurse aide and work your way up. This will make you a well-rounded nurse. Now, in comparing these, to compare the professional fields, these ladies is like comparing apples. The physician assistant along with the nurse practitioner are both mid-level providers. They both are able to care for patients, with the differences being qualifications and educational backgrounds. The PA follow a disease-centered model of practice, whereas the nurse practitioner follows a nursing/patient focused practice. Like Granny Smith apples and Golden Delicious, they both make wonderful pies but are called very different names. The LPN is like the Red Delicious apple. This is the one we are most familiar with and most have the most contact with. The LPN is the nurse who is at the bedside as an advocate between the PA and MP and the patient. The LPN has the ability to further his or her education to become a nurse practitioner if the desire is present. Now, becoming a physician is my dream, and I find myself coming back to this quote from Luanda Graze, who stated, "Medicine is only for those who cannot imagine doing anything else." And honestly, I really cannot. After the many experiences and talking to these ladies and understanding the medical field, this is exactly what I want to go into. I could not imagine anything changing my mind. And like I said, these ladies' advice was very contagious. And I do not take my decision to become a physician lightly, as well as the lives of people in my hands. As the quote from Daniel P. Logan is, "Always remember the privilege it is to be a physician." Now back to my patient. Okay, thank you. I'll be there in just a few minutes. I'm sorry about that, Miss Jones. Now let's finish your examination.